Hello, my name is Caleb Smith with the Rocket Miner newspaper. We've had a lot of stuff today, stretching into the evening. School board meeting for Sweetwater County number 1's wrapped up. College board meeting wrapped up just before that. It does help when not all of them have an executive session. Sometimes they still do. But to go over the headlines, perhaps you're like me, and the first big update you saw this morning was Walmart announcing that it was going to require customers to wear masks at all of their stores. It was noted that currently more than 65% of its more than 5,000 stores and clubs are located in areas where there are already some form of government mandate on face coverings. This new policy will go into effect on Monday. As the day progressed, some other chains announced that they were making similar changes to their guidelines. Kroger Company, which operates the stores Smith's, said it would follow suit starting July 22nd. So be watchful for places that are going to be adding to that will be joining the list that have no shirt, no shoes, no masks, no service. Today, Mission at Castle Rock announced that one of its staff members had tested positive for the coronavirus. And for that reason, all residents and all staff members were tested as well. We're told that the results are estimated to take between 4 to 8 days, but it could be longer, according to a message posted on the company's Facebook page. Elsewhere, it's been noted that with an increase in testing, especially in some areas experiencing hotspots, that there's been some places and health outlets are reporting a longer delay in getting results than used to. Now, people can still keep in touch with those who are at Castle Rock. There are appointments for family and friends, so you can have a window or outdoor visits. You have to follow the current state health recommendations for long-term care facilities, and this includes physical distancing and face coverings. And, of course, you can always keep in touch with a lot of the ways you have in the past, whether it's telephone, email, text, video chat, social media. Mission at Castle Rock notes that visits inside the facility are presently limited to hospice and end-of-life situations. Today, the governor gave an update on sharing his outlook on the coronavirus, statewide orders, the budget. One of the things he stressed is that the recent uptick in cases and some other barometers, like the number of hospitalizations related to COVID-19 and other things, prompted him to extend the orders till at least the end of the month. He said personally, on July 1st, he was optimistic that he was going to be able to end the health orders. And honestly, he displayed more than a little bit of frustration and anger with the public. One thing the governor said is that there is no constitutional right to go infect somebody else. He also stressed that for all the people talking about constitutional rights and what you can and can't do with your person and your property and your business, stressing that when it comes to local stores like Menards, Walmart, Smith's, this is their right. Quote, this is their prerogative. If they say no shirt, no shoes, no mask, no service, by God, I'm going to respect that. As a personal note, and having worked in retail and having worn a Walmart vest as my first real job that wasn't just odd jobs for family or friends, these employees don't make the policies. They probably have some strong opinions on those policies. If you don't like the policies, don't take it out on them. They're doing their best with the occasion where they have. They've probably dealt with other people who have voiced the same opinions beforehand. Trust that your outlook's being communicated. And if you want, a lot more stores are offering curbside delivery where you can go to the store, pick it up outside, head your way. Please consider that as an option. If anything, it will make it that much easier to get through the aisles if you're not joining the others on the inside. One of the other things that came up in the questions, outside of the normal statements, was a question was raised asking Dr. Alexius Harris, the state health officer, if there were ever any false positive for these tests, are they removed from the numbers? And she said that yes, that's why in many cases more than one test is administered. We've heard officials at Sweetwater County, Memorial Hospital, Sweetwater County, talk about how they do more than one test, and that's one way that they're able to make sure that there's not a false positive, false negative. And Dr. Harris said if it comes to their attention that there's been a false positive, they're sure to remove it from their numbers. One other question that was raised was looking at the number of active patients versus those that have recovered. It was noticed that right now, it's the last few days, our number of active cases have gone down, and the governor actually stepped in and said that that's great, and that's something that we want to see. We hope that trend continues. But one thing also to note is that just a few weeks ago, we were in some cases just under 200 active cases. We're more than 400 right now. So while there's been a decrease over the last couple of days, over the last couple of weeks, it is we've gone up by a lot. And there are that's something they're keeping an eye on. There are other factors that you look at to see where things are headed. And one other thing the governor said is that he's hopeful that the people of Wyoming, as they go forward and look at the information and make informed decisions, they make responsible decisions. He said that's constitutional rights, constitutional responsibilities. He said he personally does not want to issue a statewide mask requirement order. He said that he's in favor of places where communities, city councils, county commissions decide to do so. But he's still hopeful that he doesn't have to have such restrictions. Since we've talked about the numbers, let's go through them. When it comes to, and we'll start with the active cases. Right now we're up to 459 active cases, which is about less than yesterday, according to the Wyoming News Exchange. Sweetwater County, we're reported to have 36 active cases. Spiraling back and looking at some of the total figures, if I can pull up the right tab of my computer. The Wyoming Department of Health is reporting 1,605 laboratory confirmed cases, 380 probable cases, and 22 people who have died COVID-19 related deaths. That includes 146 lab confirmed cases in Sweetwater County and 11 probable cases. Now, normally, this is where I would transition next to national figures provided by the Centers for Disease Control and Prevention. I'm personally going to look to a different source for the coming days. The reason for that is that the federal government issued guidelines that hospitals should no longer transmit figures directly to the CDC, but to a new entity that's being sent up. I don't know the reputation of this place. It's kind of new. It's not a place that's proven itself to be impartial, nonpartisan. I'm not saying it's wrong. I'm just saying it doesn't have a proven track record, and we try to go with information that's from sources that have been a bit more tested. The Associated Press uses Johns Hopkins University's figures. We ourselves turn to that for national figures, and I'm just going to be providing those. And just in case you're curious, like I am, Johns Hopkins University specifically pulls information from the coronavirus COVID-19 global cases by the Center for System Science and Engineering, which is at Johns Hopkins, in addition to the Red Cross, the Census American Community Survey, and the Bureau of Labor and Statistics. So it's reporting that total cases in the United States are up to 3,495,536, and that there are 137,358 deaths. And when it comes to recoveries, there's been more than 1,075,882 in the United States. Globally, same source. We're now up to 13,512,693 total cases, and the global death tolls at 583,359. Now, locally, we've had some very important meetings tonight. We had Sweetwater County School District number 1 and Western Wyoming Community College past meetings where they approved budgets and their reopening plans. They were a little bit simultaneously, and if you were in my house, at one point you had multiple screens going and a little bit confused cat, and a reporter who was trying to be less confused than the cat. I'm only writing one. I was keeping an eye on the other one. What was Chase Galleys has hopefully already posted a story about Western Wyoming Community College approving its budget and going into it and its reopening plan. Now, in both cases, it's stressed that this is a starting point. Changes are inevitable, but there's still certain guidelines to be expected. Starting with Western, masks are going to be required when, in most cases, based on guidelines from the state, Centers for Disease Control and Prevention, where social distancing can't be maintained. Now, if you're in an office by yourself in a corner, you probably don't have to wear a mask, but it's still encouraged. They're going to be practicing social distancing. One of the things that came up at Western saying is that if they have to make changes, they'll only make changes in one direction, meaning if they go to virtual classes, they don't plan on switching back, recognizing that's trouble for students and staff. They're hopeful that they're able to continue in-class learning, and if there's a case where the student or staff member has to be quarantined, that they're still going to try to work with them to be able to continue that. One other thing that notes is that right now the college is skeptical, but hasn't made a final call, on whether or not there'll be fans allowed at sports games, particularly indoor ones. If it is allowed, and that's a qualifier, it's anticipated that the fans, we'd all have to wear masks, and do social distancing, even if outdoors too. Well, that remains to be seen. That depends on decisions made by the National Junior College Athletic Association in addition to our own state guidelines. Sweetwater number 1 passed similar guidelines. There's a lot of things that they can't say with confidence yet. They're hopeful that when we get to the end of the month that the governor will pull back, will drop some of the restrictions that are currently in place. But they have plans that if they continue, if they get stricter, the school district stressed that in the spring they did a lot of what they called chaos or trauma education. But they've had months to see what worked well, what didn't, what are they going to try, let's get some equipment in there, let's do some, let's talk about strengths and weaknesses. And the goal is that you can have, as a family, you can choose to have in-person education. You can choose to have, maybe do a little bit of distancing with some class, but still staying at home, being at distance. Perhaps like going in for like certain specialty classes or treatment or programs, but still doing distancing. You can also choose to do completely online, all at home teaching. They're working to have systems set up where families in need can get hotspot Wi-Fi at their houses. Through a similar process of getting like free or reduced lunches. In addition, people are encouraged, remember, it doesn't roll over. Please sign up to get your free and reduced lunch. Even if you don't think you qualify, apply for it. You might be surprised at what the benefit it comes to your family. They're anticipating that masks are going to be required, especially in cases where you can't do social distancing. They expect there are going to be some times where, because of the number of kids they have to put on the bus, masks or some sort of facial covering is going to be required. Might be masks. The school districts said that they've been outsourcing, and they were going to have masks for all the students, disposable masks, face masks, sometimes masks that have a clear bit. So if you're especially a kid who relies a little bit more on reading of lips, you can still better communicate what's going on. Other type of variations of face shields with hats or other things to take care of kids that may have other needs. The goal is that they're trying to be to fit all the families. We have a lot more questions to go. There's a lot of details that honestly still aren't figured out yet. Getting the approval from the school board tonight was important, so they can take this as a framework, and they're going to work on educating the public, we're doing our part to partner with them, amplify their voice, get these details out there. One of the major things that they kept coming back to is that the school district is trying to make decisions based on the guidelines laid out by the state, federal guidelines laid out by CDC. They don't want to be political. They don't want to be making policy based on personal preference. They're trying to be as flexible as possible, but there are just going to be some cases where this is what the state mandate is, and so this is what is going to happen in Sweetwater County. There are some things that are just not non-negotiable. Not because the school district, Sweetwater County made it so, just because the higher-ups did. One other thing that I would pass on that came up repeatedly at the meeting is they encourage people to reach out, ask questions, try to figure if you have a concern, if you just you have a scenario you want to talk them through, they want to help you get the answers to make an educated guess. Whether that's seeing what your options are, because you might have people in your house who are vulnerable, or people who may not live under your roof, but they're a big important part of your life. You see them frequently. The idea is that, from what we can tell, this could change. They stress that, but the district doesn't expect there to be a medical waiver required if you want to have online classes, partially or fully. You don't necessarily have to come up with a doctor's note, or you have to point to a person in your family. It can just be, I'm concerned for my kids. I want to do distancing. They're going to try. They want to work with you with that. We have a ways to go. This virus isn't going away overnight. A couple months ago, it was noted at the governor's press conference by Dr. Harris that we kind of hoped that a couple months ago this would probably go away and this would be short term, and that's obviously not going to be the case. We've had hot spots in the community. We lost one of our own yesterday. We're still pushing to keep these numbers light. We're still trying to make the impact as less as possible on our businesses, on our families, on our loved ones. The biggest influence we're going to have in fighting this will be our own attitudes. Superintendent Kelly McGovern noted that, especially when it comes to back to school and preparations and trying to help the kiddos get in the right mindset, is that kids are always listening, even when you don't think they are, even when you swear they're not. They're picking up our attitudes toward policies or changes, and we can help shape what their attitudes and opinions are going to be. If we're trying to be positive, if we're trying to stress that, yes, this is a crazy time, but these are things that we can do to make things better, look out for one another, we can help make things a little bit less scary. We can try to we can try to make it better for our community. One of the other things that came up, which is common sense, is that if we're looking at places that have been successful in opening summer schools and similar programs, it's primarily it was communities where they kept their numbers down. If your community is defending itself from the outside of this virus, it's easier for those on the inside of the school district to protect themselves. And we'll go into more. I encourage you to watch the video. It talks more in depth about the cleaning they're going to do, the hands-free temperature scans that students will be able to go through, the guidelines, the questions that parents are encouraged to ask their kids each day. Do they have a fever? Have they had nausea? Which isn't new. I mean, it's always been the policy. Don't send your kids to school sick. That's not something that came up now. That's long been the expectation, and it's that much important now. You don't want to be the one who didn't take the time to actually take your kid's temperature, to pay attention to them in the morning. Send them to the bus stop where they hang out with 5 or 6 kids waiting for their ride to show up and potentially infect them. That's not just your family, especially if you have the parent that has to get drawn back in. That's potentially the bus driver and all these other people who unknowingly are getting caught up in this. There are going to be more requirements coming unless we step up our game. I think some of this stuff's better if we do it voluntarily. There's some precedents that I don't like where they could lead to when it comes to when you give government more power as opposed to leaving it in the hands of the people. But there are also some times where if progress isn't being made, the government steps in. I am hopeful that we're making responsible, considerate decisions as we go forward. Because what the choices we make individually impact so many people around us. That's even more obvious today than it's ever been. So please keep reading up on the developments, on our latest understanding. We keep making pivots based on our current best understanding with knowing that things will change. And just keep an eye out for one another. And like I said, be kind to those Walmart employees. They're doing a lot. And other people in stores. They're heroes. And best way that you can show your thanks is to have their back. And wear a mask. This is Caleb Smith with the Rocket Miner newspaper, wishing you a good day and a safe tomorrow.